Hello, Jordan. Can you see and hear me clearly?
Yes.
Excellent, excellent. All right. Well, I can see and hear you as well. So, welcome. My name is Avery, and I will be your host for the simulation today. We have about 25 minutes together to complete your scenario and reflect on the experience. So, were you able to review the details of your scenario?
Yes.
All right. And are there any questions I can answer for you about it?
I don't think so.
All right. Well, let's quickly just go over the goal. So, in this simulation, you'll be practicing counseling a patient and making recommendations of supports available to him. So, with that in mind, we know from the scenario description that Don is currently without stable housing and that he was just released from the ER. So, what do you think his most urgent need is?
To find permanent or at least semi-permanent housing.
Yeah, absolutely, absolutely. And when you think about the mission of developing a care plan that addresses the patient's most urgent need with a practical follow-up strategy, what is the very first thing that you want to do in the simulation?
I want to make sure that Dawn feels heard. I know that Dawn is concerned about his dog, and having to give up his dog or living in a place where his dog is not able to be with him, and that that's a
Mhm.
non-negotiable for Dawn. So making sure that Dawn knows that we understand that and that we're going to do our best to make sure that those needs are met.
Wonderful. All right, so really making sure that he feels heard and understood and what his priorities are. Excellent. All right. Well, couple quick logistical notes. If you need to pause for any reason, just say pause simulation and I'll return to answer questions or offer any assistance that I can provide. And then your scenario with Dawn can take up to 15 minutes. After that time, I'll come back to, just share a little bit of feedback and reflect with you a little bit. So, and it's possible I may need to end the conversation, midway to be able to do that, but just so you know, it's just so we can have that reflection. Any final questions before we get started?
I don't think so.
All right. Well, then, when you see Dawn on your screen, you can begin your conversation. And then I'll come back to chat with you afterwards. So have fun, and I will see you soon.
Thank you.
Absolutely.
Good afternoon, Dawn. My name is Jordan. I'm here because I wanted to work with you on where do we go from here? Because since you were just in the hospital recently.
Yeah, yeah. Nice to meet you. Yeah. I mean, I know a social worker in the ER said you all might be able to help.
Sure. From what I understand, and please let me know if there's anything else. Um, you do have type 2 diabetes, but have been struggling to stay on top of it and monitor your blood sugars and get your access to your medication. Is that right?
Yeah, yeah. It's all feeling pretty overwhelming at the moment, I guess.
Hmm. Um, have you had the ability yet to apply to state funded insurance, or do you need help filling out all of the paperwork?
Uh, yeah. No, I mean, I haven't really known where to begin with any of that. I don't know. Kind
Sure,
of
sure.
just
No
people,
problem. That's something
you
we
know.
can address today. We can um, work on getting you set up for state assisted insurance as well as getting you on SNAP, which is like food stamps. That's just the name of it today, these days. Uh, and it can get you some resources so you can get some food and get some insurance so we can make sure that you're able to see doctors and follow up both with a medical doctor and a looks like a therapist, um, because it looks like there's some underlying mental health stuff, like you might be a little bit depressed. So somebody to talk to as well as seeing a medical doctor to just build up better strengths and better strategies for you to help manage your condition. Does that sound like something we could do?
Um, yeah, I mean, I'm willing to hear, what might be available and everything. I guess I just don't know if anything's really going to work for me. It just hasn't
Sure.
really panned out in the past.
Um, the other thing is, I hear you have a dog.
Hmm.
Is that right,
Yeah, yeah, Bo.
Bo? Um, and that it's really important to you that you and Bo stay together because you had to leave him somewhere while you're in the hospital, and so it's really important that you guys get a safe place to stay together, right?
Yeah, no, I mean that's definitely really important for me. I mean, he's not only my dog, he's my best friend, so I'll stay on the streets before I abandon him.
I totally understand. Um, our pets are like our children. We wouldn't just leave our children. So
Yeah,
I have
exactly.
a couple of resources that I've reached out to um, that can assist with people who are currently unhoused. Um, the Pets for Homeless and another pet friendly shelter. So I'm waiting to hear back from them on space so that we can get you on the list at the very least, or find you a safe place for you and Bo to stay together.
Oh, okay. Is is that like a permanent thing, or how does that work? I know it's been really hard for me every time I've looked at shelters. None of them have, let me bring Bo
Right.
with me.
Right. So that's why we've specifically reached out to ones that do allow people to bring their pets with them. Shelters, of course, are temporary, but the Pets for Homeless program is a program that can help you work to transition to more permanent housing for you and Bo.
Okay. I mean, yeah, that would be, that would be fantastic. I mean, that's really the most important thing to me right now is finding somewhere for me and Bo to stay.
Absolutely. Um, I also want you to work with a social worker, and I'll help you set up these appointments so you don't have to try to call all these people and set up all these appointments on your own. Who can help you apply for when we're talking about the health insurance and for the SNAP benefits. I'm going to help you set up an appointment with somebody today. The appointment may not be today, but I'm going to help you make sure we have that appointment before you leave today. And they'll help you set up for state funded insurance and housing benefits. And they actually may even be able to help you get a no cost phone, because I know that sometimes when you're looking for jobs, if you don't have a phone number, people getting a hold of you, it's hard to make those connections.
Yeah, no, I mean that's for sure. I mean, just in general, not having a phone is hard for appointments, transportation schedules. But yeah,
Absolutely.
that would be great.
Yeah, and there is a program through the state funded DSHS that we could probably get you a phone in the next couple days as well. I also
Okay.
want you to start meeting with community health nurse. They're nurses who help people who may not have the financial means to go to the doctor all the time, but can help you uh, learn more about your diabetes and how to take care of it and how to take care of you, because you're important and we want you to be as healthy as you possibly can, even if you have a chronic disease.
Okay. Yeah. Sorry, I'm just I guess having a hard time following all the information. It's just a lot of like different doctors and everything, so it's a little overwhelming.
That's that's fair. There's going to be a lot of different people um, that we're going to put in place and help you to support you and make sure that you have everything you need so we can get you out of this situation.
Okay. Yeah. I mean, I appreciate it. Like I said, I've been offered some of these services before. Just it feels like things always kind of get in the way.
Sure. So also today, I'm gonna give you some bus vouchers and some resources for transportation. Because again, if we're looking for that job, we need to be able to get there. Even if somebody offers you a job, if you can't get there, if you can't afford to go on the bus or you don't have a reliable vehicle, it can really mean that you lose those opportunities.
Yeah, I mean that's true. I mean, transportation in general has been hard, even just for getting to follow up doctor appointments. I mean, honestly, the job situation's been less of an issue, unfortunately, just because I've tried looking for jobs, but you need a permanent address to even apply. So I've been kind of caught, without really any options to even try to apply for work.
Sure. Um, Well, that's why I think that it will be important to get you set up with one of these organizations that can help you transition from like a shelter or short time situation to a more permanent situation. It'll be better for you and for Bo, you know. You guys having a stable home together where you both can lay down your head at the end of the day, that's important.
Yeah, I mean, I agree. That's really is my number one priority at this point. I know I've got a lot of other things I need to deal with as well, but that's been you know, what's been most important.
Absolutely. Let's see. So the major things we want to set up today, and I'll help you set up these appointments and make sure you have all the information. We'll make sure that I have it all written down so you don't have to remember it all in your head because I know that they can be hard. If you have to remember everything in your head that you're supposed to, what am I supposed to do next? Where am I going? Who am I talking to? So I'm gonna get a write up made up of you for you, with the information on the social worker that I want you to follow up with, and they're gonna be the person who helps you with uh, housing vouchers and your SNAP benefits and your state insurance benefits. I'm going to set you up with a contact information and the information on and an appointment with a community health nurse who's going to help you manage your diabetes and make sure that you understand what your blood sugars mean, what uh, how to manage those, how to manage those effectively, and how to even on a limited budget eat good foods that will keep you from getting those high blood sugar spikes that can send you back into the hospital.
Okay.
And then go ahead. What was that, Don?
Yeah, no, I mean that that sounds great. It's obviously, be best not to have to go back to the hospital again.
Yeah, and that can get expensive, and you have to find somewhere safe for Bo to be while you're in the hospital, and that's stressful, and that can help you not feel better.
Yeah.
And then the
So
third
I
person I want to set you up with today is a housing case manager, and they'll probably be part of the shelter we're going to work with. That's a pet friendly shelter, so you and Bo will stay together, and they are going to help with building a long term plan to get you guys into more permanent residence.
okay, yeah, I mean that would be wonderful. I guess how how do I continue to check in with you, before we figure out a phone or whatever?
Absolutely. So, when working with that social worker, they should be able to set you up for a state funded cell phone while we're still looking for a job and looking to get some income coming in. In the meantime, I want you to come by. We're going to set up an appointment once a week for you and I to touch base together. And even if you have to use the phone here in my office while you're here, if I need to set up a little bit longer session so that you need to call people back about jobs and stuff like that, we can make that happen. Um,
Okay.
and so I want to see you once a week moving forward for about the next 6 weeks, and then from there we'll assess where we're at and what goals we still need to meet.
Okay. Um, what if I miss an appointment or something?
So I want you to do your best not to miss an appointment. And even if you miss an appointment and then you swing by and say, hey, I had a job interview and I wasn't able to make it, but just so we're still touching base, I don't want to lose track of you. I don't want you to get lost in the shuffle of things. So even if, maybe you borrow a person's phone or you come by and just say, hey, something came up, or I had an appointment with a doctor, or I was at a job interview, just so we can still know that you're doing okay.
Okay. Yeah, no, I mean, I appreciate that. It's I appreciate you being so understanding. It's been a lot to manage on my own. So,
Of
thank you.
course. And nobody ever expects to be in this kind of situation.
Yeah, that's for sure. Well, okay, so what I guess what happens next right after this? What
Yeah,
do we
so
work on those forms?
yeah, let's work on these forms together. And then we will get you scheduled. Does Tuesdays work for you?
I mean, yeah, don't have a lot on my schedule right now, so really whenever. Yeah.
Sure. And would you rather come in first thing in the morning or the afternoon?
Um, yeah, I mean, morning's fine. Yeah, again,
Morning?
doesn't matter too much. I mean, well, I mean, sometimes mornings are a little better to go to like the soup kitchen, so I don't know, maybe afternoon's better.
Okay. So why don't we do like 10 o'clock on Tuesday mornings? You come see me and we touch base on your plan and see what other support you might need.
Okay, that sounds that sounds really good. Yeah, no, I really appreciate it. I'm feeling more hopeful than I've felt in a while. So
Good. All right.
yeah,
Well, I'll see you next week, Dawn, okay?
all right, sounds good. Thank you.
Pause seminar.
Hey, Jordan, welcome back. How'd you feel that conversation went for you?
Pretty good.
Good, good. Glad to hear it. Well, do you feel ready to chat a little more, reflect a little more on the experience?
Sure.
Fantastic. So, this conversation was an opportunity for you to practice developing a care plan that addresses a patient's most urgent needs, along with a practical follow-up strategy. Occasionally, in these simulations, while well-intentioned, we'll sometimes see or people have difficulty guiding conversations like these by either insisting that the patient needs to give up his dog in order to have access to better resources, or focusing on solutions before taking the time to really understand what the patient sees as top priorities. So, did you find yourself experiencing any of those typical challenges today?
Um, I think my biggest challenge was that Dawn is feeling overwhelmed, and so it doesn't matter how many resources you can hand him. He is having difficulty managing all of that.
Yeah, yeah, just kind of in that situation of overwhelm right now with everything that it's hard to really absorb. Yeah, fair enough. Okay. Well, we've also seen people effectively navigate conversations like these by really recognizing that while the patient's dog will limit their access to some support options, that it is what the patient cares most about and should be respected. And respecting the patient's autonomy by developing a care plan that really centers their top priorities. Did you find yourself being able to use any of those techniques today?
Yes.
Excellent. Any in
Um,
particular that stood out?
I understood that Don's main priority was to find a safe place for him and his dog, and that his dog was a non-negotiable for him. That he would have backed out completely and not accessed any resources if he felt like his dog could not be where he was.
Yeah, absolutely. So really leaning into understanding, that that was really important and, not even trying to suggest that that was a negotiable like you mentioned. Absolutely. Excellent. Well, along those lines, yeah, that was actually a strength that I wanted to share that I saw that you showed in the meeting today, which was that as the conversation progressed, you really acknowledged and validated Don's challenges. Like you said, even there with, with regard to his dog and understanding how challenging it is and being empathetic to the fact that he wasn't going to be willing to, leave Bo. And how did you feel? That helped in the conversation. What did you see from Don as you validated his challenges?
I think that Don was more open to attempting to access services as long as he felt like he was being heard and that his opinion of what he needed was the priority.
Yeah. Yeah, patients who face repeated challenges often feel alone in their struggles, really believing that no one truly understands or cares about their situation. And when you validate the patient's concerns, they feel less isolated, and that acknowledgement can really provide emotional relief and reduce feelings of hopelessness, which can make patients more receptive to exploring solutions. So, like you said, yeah, just really about him feeling like he was really being heard. So, yeah, wonderful. Well, since even our strongest leaders can always improve, I'd love to also highlight an area of opportunity for you to consider as you think about future development. So, yeah, so I noticed, and I know we kind of chatted about this being kind of where you wanted to start, and I thought it was interesting as I noticed it progressed and we got there. But at the very start of the meeting, there may have been a little bit more of an opportunity to directly ask questions to understand Don's priorities and concerns right off the bat. Um, I know you were very familiar with what his background was, so you had your solutions based on what you believed were his priorities, and they did seem to end up aligning. Um, but I noticed that you kind of started that solutioning a little bit before really asking him and just having that open-ended conversation to really get him to share his top priorities. How do you think that might have helped or changed the way that the conversation flowed to have taken a couple moments to really do that?
I think that maybe he would have been more receptive from the start had I asked him, and then been like, yeah, that's looking at the feedback from the other people who you interact with. This is kind of the plan I've worked on, and showing that my priorities for him aligned with his.
Absolutely. Yeah, that's exactly right. Again, really happy that we got there and with that, acknowledgement and validation, like we talked about, it helped a lot. But yeah, there was still, it took him a little while to really kind of warm up to being a little more receptive. And I think what you said is exactly right. Just giving him that opportunity to really share his priorities and concerns right off the bat establishes that foundation of trust and respect and collaboration. And particularly for patients who feel overwhelmed and anxious, starting with questions about their concerns can help to provide that emotional relief and just really shows their struggles are recognized and the conversation is not just about giving advice, but about listening and understanding first. So, yeah, I love that. Excellent. Well, Jordan, it has really been so lovely working with you today. I want to thank you for practicing these important skills with immersion. Before we go, what's a takeaway you've had from this experience you might use the next time you face a similar situation?
That even if you have done all the research and then found all the sources for somebody, that you still have to listen to what they think is the most important thing to them.
Yeah, I love that. Yeah, it's such a small thing that we don't always think about, but just even knowing that they're being asked that first and really helps to help them feel that connection and feel heard. So wonderful. Well, Jordan, again, really appreciated our time together today. So thank you, and I hope you have a lovely rest of your day.
Have a good day.
All right, take care. Bye bye.